Hi everybody. So this video is mainly targeted, I would say, at the younger age group of females. So that is, say, from about 17 to 20. And these are some of the common queries that we get from clients your age. And we're trying to get some concepts into you so that you don't feel that something is wrong with you. A common distressing problem for which we get inquiries for or queries for is something related to the breast size. So many young girls approach us to find out if their breast size are adequate or whether they need to do something about it, and most of them are looking for solutions like creams and lotions and injections. This is a difficult time period in your life where there are a lot of changes which are happening in your life as well as in your body, and then people tend to get confused. You're exposed to a lot of social media, a lot of influencers, so-called, and people who are portraying a different body image. So many of the girls who approach us, they talk about lack of body confidence because of what they see and hear in the media. So first and foremost is you should not be influenced. Social media is good to a certain extent to find the proper things that work for you, but there is no sense in just following everything blindly just to become like somebody else. So once puberty starts, the breast development also starts, and it can continue right from about, say, 12-13 years, and it can go on up to 21 years, and you still have to wait it out till then. Some girls develop early and their breast sizes also increase early, and some girls develop late. So there is no universal formula for that, and you just have to wait it out. Girls can continue to grow till about 21 years of age, and that is why when patients ask us for implants or an augmentation procedure, we ideally advise them to wait till they are 21 before we can do a procedure for them, because the size of the breasts continue to grow till then. If you look around you, you'll see that everybody is different. Okay, body structures are different, facial structures are different, facial features are different, and look at the noses are different, ears are different, eyes are different. So there is no sense in trying to become like somebody else. Okay, you have to be happy with what you have, but you have to, if you find that if it is not in proportions, how do we decide whether something is right or not right in the body? We decide by proportions. Everything in nature has a balance, and when you look at it, the left and the right are symmetrical, the up and the bottom are symmetrical. So that is how nature creates things. So when you look at somebody or you look at yourself and you see something that is not in balance, that is when you know that something is off. So when it comes to something like the breast, how do we say whether it is in balance or not? Because there are different sizes of breast, there are different shapes of breast, there are different colors of breast. So how do you know? So you have to look at it in two perspectives. How we see it is, one is in proportion to your body, and one is how comfortable you are with it. If you're comfortable with smaller breasts and that is your preference, then that's fine. If somebody wants bigger, then that is also fine. It's all your individual choice. Secondly is body proportions. When you're looking at your body proportions, so when you're looking from the front, if it is in balance with your hips and your shoulders, then it looks all right. When you look from the profile view or the side view, if it's in balance with your buttocks, then it looks good. So if it is out of balance, that is if it is either too small or if it's too big, that is when it starts looking obviously that there is something which is not right or which is off balance. If that is the case, that is when you can opt to do something about it. Another thing which youngsters often talk to us about is that both the sides are not equal, or one side is bigger than the other. So that is also normal. And 99% of the women have different sized breasts, though the disparity might be small in some cases, or it might be very significant in other cases. Another common problem that youngsters face is something called a retracted nipple. So in many cases, as your glands are developing and you see that the nipples are retracted and they are not, or something what you call as an innie rather than an outie. So if that is the case, then yes, you have to start doing something. You have to talk to your gynecologist or a doctor and start making them, trying to use massages and traction to pull them out, because that can cause problems later on in life when you're breastfeeding, by causing infections and other issues. So if that is something there, then that you consult your doctor and they will tell you what maneuvers you can do to do your massages to loosen the ligament so that the nipple can come out. So wait for the growth, not worry about the size. If it is in proportion, wait till you're 21 till you actually think about doing something. And everybody is different, everybody has different sizes, everybody has different shapes, so don't be too worried about it. Keep a healthy diet, don't overindulge, don't overeat, because that is another significant time in your life when suddenly everything is changing. We tend to stress eat and we put on weight, so that is also bad, because that leads to stretch marks and then that can cause more stress. Then don't do anything just because somebody else is doing it. If it is not right for you, then there is no need to do it. If you are already in a proper balanced state, then be happy with it. And if you have a problem which you think is bothering you, then yes, talk to a professional so that you can seek proper opinions rather than looking it up on the net and going and having some creams and ordering some lotions and all, which have God knows what all, and it might affect you adversely. So rather take a proper professional opinion about such things and go to a plastic surgeon who can talk to you about the breast, or your gynecologist who can talk to you about your hormonal changes which are happening. And the most important thing is, this is a period where everything is changing in your life and especially your body, and there is a lot of peer pressure to do a lot of things. So be happy with what you have, okay? Learn to accept and balance what you have. If something is out of balance and is bothering you, then yes, please take opinions, take a second opinion and take a proper opinion from an expert. But try and wait it out. These are times when things are changing, and things will change and nature will take its course. And yes, after 21, 22, if you still feel that yes, you haven't reached where you want and you want some help, then yes, you can get in touch with us. So we will definitely do what is necessary for you.